Just past the hour 2 on Joy 99.7 FM. Ultimate Health with me, Nortey by nature. A bit of a long play of Dave Cause together again, and we are indeed together again, 11th of February. I'll do my praise at the end, so let's roll into business. So you're most welcome aboard. Oh, just whisked into the studio. Apologies.
Joy 99.7 FM.
As you can tell from my voice, still got this niggling, what should I call it? It's not a throat thingy, it's not exactly a cough, it's not a cold. I guess it's some wavy, yeah? So today I'm taking a look at the impact of the current weather and environmental conditions on our health. Respiratory conditions or irritations, throat issues, headaches, fever, dehydration. That's what I'm talking about today on Ultimate Health on Joy 99.7 FM. And I think on Friday the 9th, right, we had an advisory given or issued by the Ghana Medical Association cautioning us and also outlining some tips. So if you've had a cough, throat irritation, difficulty swallowing, it's a mixed bag of things. Today we're talking about it on Ultimate Health. If you have any questions, concerns, WhatsApp is 055 11 11 997. Today all my guests are on Zoom. We'll still get it done. Dr. Pascal Kangberry is a resident with the Department of Medicine and Therapeutics at the Kolebu Teaching Hospital. I think he's specializing in respiratory disorders or respiratory medicine. Dr. Emmanuel Asante is a specialist family physician, currently practicing at the Medina Polyclinic, and they join me on Zoom. If you have any questions, concerns, experiences you want to share, WhatsApp is 055 11 11 997. Let me check if my docs are online. Dr. Asante and Dr. Kangberry, are you online?
Yes, I'm here.
Right. Who just responded? Emmanuel?
Asante.
Dr. Asante, you're most welcome. Did I get your designation right? You're a resident in at the Department of Medicine and Therapeutics in Kolebu?
That would be me.
That's rather Dr. Pascal Kangberry.
Yeah.
Am I pronouncing your surname right?
Yes, you are.
Okay, I am. All right. You are a resident at the Department of Medicine and Therapeutics.
Yes, I'm a senior resident then.
Senior resident. My apologies. And
let
me get it right. And you're specializing in respiratory disorders? Or
yes,
you are. Okay. And then on the other side, I have Dr. Emmanuel Asante. Doc, good afternoon.
Good afternoon.
Right. You're the Medina Polyclinic. Yep.
Yes, please.
Okie dokie. Yes. Great to have you. You're a specialist family physician. And I see here that you're also the president of the Ukraine Trained Professionals Association and also a director of biblical studies at Zion City Theological Seminary. But anyway, we've grabbed you because of your expertise in family medicine. So both of you are welcome. I started my long intro with, should I say, reference to the current weather and environmental conditions. the EPA has issued, should I say, an advisory from Dr. Kokofu, the head of the EPA, cautioning us about, should I say, air quality. Because it's Hamatan, there's a lot of dust, but there's a lot of pollutants as well. Indeed, I saw something I'll refer to shortly, which suggested that the air quality in Accra is way, 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 way beyond what the WHO standards permit. And indeed, something, I think earlier this week, ranked us as having one of the worst air qualities globally. But alongside that, the Ghana Medical Association has also issued a directive or a press release citing the current conditions and also giving certain advice. One of them being that we should restrict or reduce outdoor activity if we can, and if it's not necessary. We should consider going back to the use of masks, and then they make some comments about an upsurge in respiratory conditions. Let me start with you, Dr. Kangberry. Your comments initially on this. I note, as I ask you this, that last year, February, we had an advisory from the GMA as well. So is this normal? Is this just a seasonal thing? And then your comments on the releases I've referred to.
Okay. It's always good to have reminders here and there, even if it's seasonal or yearly. You know, some people may take it serious one year, not serious the other year, but it's part of our duty as doctors to also keep the public informed about various health risks that are there per season or per weather change or whatever it may be. So it is good that they do that because we have your best interest at heart. So giving you yearly reminders, the precautions to take is important.
Okay.
Yes, every season there is some, let me say, outbreak or surges of certain conditions, whether respiratory or other illnesses. For the Hamatan, because of the dry nature of the weather and then the dusty nature of the air, it makes it very difficult to breathe, especially for those who may have pre-existing lung diseases. So it may just make their conditions worse or much, or exacerbate their symptoms or very difficult to control. Okay. And that will reduce their quality of health.
Right. So we're likely to see an escalation of the numbers of these types of complications at our facilities.
It is possible. Nothing is always cast in stones, but we always prepare for the eventuality that does happen. We are hoping it doesn't. If it doesn't, it will mean that people are taking the communique more seriously. Okay. Therefore, they're sticking to advice and hence not experiencing those complications.
Okay. Right. Let me come to you, Dr. Asante. I mean, you thankfully are based at a polyclinic, lower tier facility, as most will say, but very, very, very busy. What are you seeing? What's the picture? And what's the experience typically around this time of year?
All right, so thank you and greetings to all your listeners and happy Resurrection Sunday to you all. So today happening to be a Sunday. Okay, so basically I think my colleague has said it all. We are in the time of the season where, I mean, Hamatan is around, and with our settings, okay, we are interested more, right, in disease prevention and health promotion and all that. So, I mean, we do a lot of health talks, especially with regarding the challenges that we are likely to face with this dry Hamatan season. We've seen some cases. I mean, there's been a little surge, right? I mean, be it adult or children coming in with respiratory conditions, right? With cold illnesses, catarrh illnesses. We're talking about exacerbations of asthmatic attacks, those already with pre-existing respiratory chronic medical conditions, like we're talking about emphysema, chronic obstructive bronchial diseases, and the likes, and even folks with sickle cell diseases coming with crisis, and people with eye problems and difficulties, seen and all that, all related to, from the history,
Okay.
The dry harmattan season that we have. So
Okay.
we've had quite a number of cases regarding respiratory illnesses because of the harmattan.
Right. So, folks, if you just joined us, we're looking at the impact of current weather and environmental conditions on health. I've got speaking to us just before I came in. Was Dr. Emmanuel Asante. He's a specialist family physician. He's practicing at the Medina Polyclinic. And then we also have Dr. Pascal Kangberry. He is a resident at the Department of Medicine and Therapeutics, Kolebu Teaching Hospital. He's also specializing in respiratory disorders. So we've heard and read, hopefully, the warnings issued by the GMA with regard to the weather, harmattan, and then also quality of air, which is also so pollution and other environmental pollutants, which we should be mindful of. We're looking at the kind of challenges you are facing. You can share yours with us, 055 11 11 997. We're live on Facebook and YouTube. We're also interested in when should you present? I mean, a cough is a cough, sore throat is a sore throat. But at what point should you now go to hospital? Because many of us also typically are presenting at the pharmaceutical outlets and purchasing all sorts of remedies. We think we're on the right track. And for some of us, it goes away. For some of us, it remains lingering. So share those with us on our WhatsApp line. And then I'll also pick a few more bits of information from our guests and resource persons. So coming back, Dr. Kambere, I mean, sore throat, cough, and the advisory specifically talks about reducing or avoiding outdoor activity unless necessary. Okay, so going to work, going to school, you can't stop doing that. What does this mean? Are we talking about, should I say, primarily airborne challenges? Because there's a reference to use of face mask and so on and so forth. What kinds of signs and symptoms should the public be aware of in relation to the weather and environmental conditions?
Okay, so there are certain outdoor activities you can't avoid, like you rightly mentioned, going to school, going to work, etc. So, but as much as you're going, you also have to take the necessary precautions, like wearing face masks. This is just to prevent the amount of dust burden that you may inhale during the period of your transit or commute to those things.
Okay.
Also, outdoor activities, people do a lot of outdooring and then a lot of partying, outing. So those ones, if you can, we will recommend that you avoid or put on hold for the time being, just so that you're not too exposed to the dust. And then, like you said, the environmental pollutants.
Okay.
It's not just the harmattan weather. We know that in this dry season, people burn a lot of things, refuse, so the winds kind of blow some of the contaminants all around the environment, which you can inhale and then experience certain complications.
Okay.
Most often for respiratory tract infections or problems, most common you will have is cough. That's one of the most common symptoms.
Okay.
You can have a sore throat, depending on the condition. You may be sneezing a lot, runny nose. Some people may have itching of their eyes or itching of their throat that they may do a lot of times, or you see them scratching their ear a bit of times like that.
Okay.
So it can go that you are developing either an allergic reaction to something that you've inhaled. Mm-hmm. If it's more serious, like an infection, whether viral, bacteria, you may have a fever, you may start producing phlegms, which may be thick, mucoid, yellowish, etc. So in those situations, we want you to avoid and then seek help as early as possible.
Okay.
Most individuals know how their normal disease is. So if this doesn't feel like your everyday catarrh for you, it's always better to seek help as early as possible.
Okay. So discomfort in your throat, sore throat, coughing, runny nose, watery, itchy eyes. These are some of the things. Are there any chest-related signs and symptoms?
Yeah, some people may have what doctors call pleurisy. That's you kind of have chest pain when you're taking deep breaths or when you're breathing, you can get chest pain as you inhale and exhale.
Okay.
And some people, they do just have general chest pain, especially when they've coughed too hard and those things. So you can get chest symptoms as well.
Right. Okay. Folks, 22 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon, Ultimate Health, your ultimate guide with me, Nortey by nature. I'm speaking to family physician, Dr. Emmanuel Asante, and a senior resident at the Department of Medicine and Therapeutics, Kolebu Teaching Hospital, Dr. Pascal Camberry. If you have any questions, concerns, WhatsApp is 055 11 997. We're live on Facebook and YouTube. Swinging across to Medina, if I can say that. Dr. Asante, I mean, some of these things, and we are told a cough typically will run its course, and most of these things typically will run a limited or, should I say, a short-term course and resolve. We've heard, with regard to other cautions and tips, a cough that lingers more than 2 weeks, a sore throat or other signs and symptoms that linger more than 2 weeks. I'm using those advisedly. I mean, when should we present? When is it a problem? And when is it just, a cyclical presentation or development associated with the season and the time of year?
All right, so thank you, Nortey. So just quickly to add to what my colleague said, you see,
Sure.
we have people who already have existing chronic medical conditions, like asthmatic patients, right? We respiratory conditions. We have people with chronic obstructive pulmonary disease and other respiratory tract-related conditions, who we advise that if it is possible to stay indoors most of the time, it will really help you save yourself, from some of the things that could trigger your condition and worsens it. So people with respiratory conditions, asthma, those with allergies and all that, should take such precautionary measures as we've shared, so that they don't fall victim to the debilitating nature that would come with this condition. So for us, as we said and as you saw in our press release, it's case by case.
Right.
All right. So I may say that when you do all the things we've advised you to do, and maybe after 3 to 5 days you don't see any improvement, come to the hospital. But we can have situations where a person may experience the severity of the condition on the first day.
Right.
All right. So once you experience that, I mean, you don't waste time. You come to the hospital, because then you may be developing a complication. Like for instance, for people with asthma.
Right.
You may be coughing continuously non-stop. You may be having chest pains and difficulty breathing and all that. It may start on the first day, or it may, probably stretch to 3 days or not. So we advise that you come to the hospital, that we see you. When you are experiencing difficulty breathing, when you are experiencing difficulty swallowing or painful swallowing, you can't breathe through your nose, you don't feel well. Right. We advise that you come to the nearest hospital so that we take care of you. So it's case by case. Okay. It's not cast in stone, as my colleague earlier says. Some situations are there, we have exceptions, but it's not always the rule. So once you experience any severity of a symptom, you've taken all the medication, it's not working, come to the hospital. Or on the first day, it is so severe, you still come to any nearest hospital anyway, so that we check you out. Okay.
Great stuff. 26 minutes past the hour of 2. Now, folks, you've heard the information. You're getting the education here on Joy 99.7 FM. But typically, I mean, this is cocoa season for the pharmacies and all the places, all the expectorants and the cough mixtures and the co-mininis. In fact, a couple of years back, I got into some trouble because there was an advisory that was suggesting, I think from international publications, that cough mixtures and other things don't really do much for children under 12. And because of my proximity to certain pharmacists and other people, I had access to that, and we did a program on that because they were still on our shelves, right? But the point I'm making and driving at is that most people will go for over-the-counter remedies, even though we're hearing the advice from my resource persons that, hey, check it up, especially and particularly, emphatically, if you have any of the underlying conditions, sickle cell, allergic reactions, sometimes even some of the autoimmune conditions react or get agitated or exacerbated by this. And so be mindful of this and present accordingly, right? My WhatsApp line is active 055 11 11 997. We're live on Facebook and YouTube, and shortly I will activate the phone lines. Also, my resource persons, Dr. Kambiri and Dr. Asante, my reading suggests that in other parts of the world, there's particular concern with regards to young children and the elderly and their susceptibility to these things. I'd like you to comment on that. And then we can go into perhaps some of the presentations and preventive measures. There's mention always of the probability or potential of dehydration. For example, at this time and in this season and under these conditions. So let's look at what I said about the medicines and a typical pattern or response, which is to go for over-the-counter remedies. What do both of you have to say on that? And then some of the advice, which is more in the preventive vein. Let me start with Dr. Asante.
Yeah, all right. So thank you, Nortey. So basically, with the elderly and the adults, the children, children, as they grow, their immune system also develop, and in the process of time, they get adapted and used to certain changes in the environment.
Okay.
So their response to certain irritants and allergens that come in contact to them, is a little bit harsh.
Okay.
Right? So the immune system comes with full force. Mm-hmm. So their body tends to suffer a lot compared to the strong, healthy adult. All right. With the elderly, as they age, their immune system dwindles down. It goes down. So, the strength is a little bit on the downside.
Right.
So then, if they encounter the condition is always a tall order and somewhat a challenge for them to deal with. So when it happens like that, I mean, for us in family medicine, geriatric care, we advise that don't waste time. Come to the hospital and then we'll attend to that. With over-the-counter medications, yes, I mean, we know in the system, the people tend to buy certain things from the pharmacy, right? Like things like paracetamol, right? Things like oral contraceptive pills, which is now permitted for people to get their hands on. Vitamin C, multivitamins, and all that. One can get those things from the pharmacy and start taking it. Notwithstanding, we're talking about now pharmacological approach, which to us family physicians is very, very crucial.
Okay.
Talking about taking in a lot of water, talking about eating fruits, taking in much fruits and vegetables, which they themselves contains water.
Okay.
Because the condition is very dry, and so then you need to always keep yourself hydrated so that you'll be able to have the healthy a way of life or a healthy body in order to fight off any irritants and all that. So it's important that fruit, vegetables, taking in enough water, and then staying indoors, not going out unnecessarily and all that would actually help. But then over-the-counter medication like multivitamin, vitamin C, and some of these things, glucose, you can reach out to them and then take them. But notwithstanding, let me add this. The thing is this: some medications have some side effects, and some medications may be contraindicated to some patients or some clients.
Okay, contraindicated meaning that not suitable for some people.
Yes.
Okay.
Yes. So that's the challenge we have with over-the-counter medication. So we advise that, we have a lot of health facilities around. Okay. Mm-hmm. So if you know that you have allergies, if you know that you tend to react to medications a lot of the time, right? It is advisable that you visit your nearby health facility. You can talk to a nurse, a doctor, a primary care physician, and all that.
Okay.
And you can be assisted. Thank you.
Okay. Great stuff. 31 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. This and every Sunday, 2:05, we come alive with all the relevant, up-to-date health information. We're doing that right now, looking at and considering the impact of current weather and environmental conditions on your health, against the background of advisories, press releases by the EPA, the Ghana Medical Association, and so on and so forth. Some of them outlining or indicating certain preventive measures and certain cautions. For example, a return to the use of face masks to limit or reduce our exposure to the pollutants, the dust particles, and so on and so forth. Reducing our outdoor activity and exposure, and then of course taking in a lot of water and fluids. Dr. Asante just mentioned vegetables, fruits, and many other things to keep yourself in tip-top shape, to facilitate your body's response and ability and capacity to fight these things. Abeko, if you can switch, if we have any WhatsApp messages, I can read them out, and then also activate the phone lines. And after I do that, I'll swing to Dr. Kangberry to check out if there's anything we've left out. Preventive measures. What should you be doing? What should you be looking out for? We've mentioned some of the signs and symptoms. My WhatsApp screen is not up yet. Okay, so I'll continue. Abeko, if I can have my WhatsApp screen up quickly, and then I'll read a couple of those out, and then give my guests a breather and come back. Okie dokie. Let me see. Scroll. Joy FM, good afternoon, Nortey. Most parts of Accra is smelling, and I think that is because some people have connected their septic tanks into gutters. What are the local governments, authorities doing to check and punish such offenders? This is from Christy in La Paz. Okie dokie. Let me see what's next. Okay. Nope, I'm not seeing that. This one from Dede says, staying indoors with the windows open, knowing the situations of our setups in that the majority don't have ACs to shut their windows. Won't it be the same as being outdoors? This is from Dede in Maryland. Dede, welcome. This one says, good afternoon, Nortey. How are you and your invited doctors? Now, my question is about the advice given by the EPA that we should wear masks according to them. Now, I would like to know when the air we breathe in is contaminated, or how harmful already can it penetrate the mask and enter our nostrils and affect us. This is from Hayford in Bator. So, are the masks we have adequate, or will the particles we're talking about penetrate the masks? Okay. I can't see who this one is from. Quickly, let me roof. Doctor, I treated my 3-year-old. Hang on. I treated my 3-year-old for a cold 3 weeks ago, and she got better, only for her to have a runny nose and cough yesterday. Is it normal? 3-year-old, okay, probably be in a creche, or what is it called, preschool. There's a lot of interaction there, but I'll let my doctors comment on that. Okay, I think I've done the run. I'll just switch back to my guests. If you've just joined us, this is Ultimate Health on Joy 99.7 FM. We're talking about the impact of current weather and environmental conditions on our health against the background of warnings and cautions and advisories issued by the EPA and the Ghana Medical Association. My guests are Dr. Pascal Kangberry of the Kolebu Teaching Hospital and Dr. Emmanuel Asante, who is stationed and practicing at the Medina Polyclinic. He's a family physician, specialist family physician. Dr. Kangberry is a resident at the Department of Medicine and Therapeutics, specializing in respiratory disorders. You heard some of the things I read out. One had to do with local government. I guess that's not really in your jurisdiction, but I guess would those things, foul smelling, whatever, places, and should I say habits that promote pollution of the air, would that also be a causative agent or a problem? If something stinks, does it necessarily harm my health? I'm being naughty.
Okay,
so, Dr. Kangberry.
Yeah. It will depend on your condition. Like if you're a normal fit individual, it may not have a greater impact than if you already had a pre-existing respiratory condition.
Okay.
Again, sometimes we may have. It also depends on what you're inhaling, what toxin or what pollutant you're inhaling. Some of them
Germs.
prolonged exposure can lead to lung problems or health problems
Okay.
down the line.
Right.
It's not instantaneous.
Okay.
People who have pre-existing lung conditions like asthma, COPD, just to name a few, they kind of have what we call triggers, and that kind of makes their condition worse, their symptoms worse. And some of them is due to strong smells. Some people it's dust, perfume. So depending on what they're inhaling, it may trigger an acute attack or an acute exacerbation. So in those circumstances, yes, it can be a problem.
Okay.
In terms of the face mask and everything, not every mask is created equal. Some will do a better job at filtering some of the particles and then dust, depending on the size of those material and how the mask is designed. So it will really depend on what mask you are wearing.
Okay.
That will determine your amount of exposure to the environmental dust and then pollutants as well.
Okie dokie. There was a question about a 3-year-old girl who had a cold, had been treated and recovered, and then suddenly, not long after, she developed a running nose again. Mother is asking if this is normal.
Yes.
Yes,
Yeah.
Dr. Asante, go ahead.
All right. So Nortey, so you see, the thing is this: for one to say she treated, a person is to us a person being a doctor in order to be able to do that.
Okay. Did she see a doctor and was the treatment prescribed?
Yes. Is it that was the child seen in the hospital or in the health facility setting, or she did it herself?
Okay.
Whatever be the case, that's why we advise that you can take some of the over-the-counter medications for a short while, but then when you are not seeing any improvement, the coughing is worsening.
Right.
Consistent, persistent cough, not stopping. The nose is so congested that he cannot breathe through the nose. He is opening the mouth and all that. You don't sit down. Come to any nearby facility, and then we'll treat you. We have medications and all that for that. Because if you waste time, it will complicate, and you might asphyxiate and have difficulty, challenges in breathing, your throat or your windpipe constricting and all that, and you may end up with something worse. So we advise that she sees any healthcare practitioner nearby, and then she will be attended to. Okay. And then one more thing. I don't know if I have to. Should I?
Oh, go ahead.
Regarding the point that EPA made, you see, the problems and the challenges we are having with harmattan or dry season in our part of Africa, has to do with global warming and climate change. We shouldn't lose sight of the fact that, West Africa has been identified as a hotspot for global warming, which basically is activities of man with fossil fuel burnings, burning of bushes, gases, and all that, being emitted into the atmosphere and distorting the climate pattern that we have. Okay. So, for instance, if we have harmattan, we know that there are already existing side effects, negative side effects of harmattan. Okay. But this time we are having a negative side of harmattan, which is deteriorating. Right. Which is worsening. Okay. Same principle applies to all the different parts. So we need to do much education, right? Cut down on fossil emission and then comply with the Paris Agreement, which Ghana is a signatory to. Okay. Thank you.
Right. Which ties in with the question, just coming, Dr. Kangbere, ties in with the question about the smelly gutters and all the effusions and things, I played light on it, but the local government, district level and other EPA interventions are important. Sanitation is important. If what you're breathing in is offensive because there's various processes of degradation, fermentation, and all that, then we have a problem. And Dr. Asante is tying it in with human practices that are influencing and fueling global warming and climate change as well. Yes, Dr. Kangbere.
So I was just going to add a little bit to what Dr. Asante
and just to remind you, as you add that, there was one from Dede which says, look, not all houses can seal themselves off and use air conditioning. So does it really make any significant difference if you stay home? Is it not the same air? So just tag that in so that we don't. Dede will remind us if we forget to answer her question. So, yeah, go ahead.
Okay. So because we are here to also advise the public in terms of conditions, like Dr. Asante said, in reference to the child, You forget children, they easily pick up other infections from their friends at school. So if the
Right.
child is in school, their first infection may have been clearly treated, so this may be a new infection altogether.
Mm-hmm.
Also, like you also mentioned, taking over-the-counter medications can mask your symptoms. It doesn't treat the underlying problem, it just
Right.
covers the symptoms.
Okay.
It's like sweeping dust under your sofa. The dust is still in the house.
All right.
So once you stop using the medication, then the symptoms will come again. That could be the case. But as you rightly said, you should take the child to the hospital for them to make sure it's fine.
Right.
In terms of the house,
if you've been to the hospital, still go again. So we're not suggesting that this person who shared this information via WhatsApp didn't go to the hospital, but the refrain and the advice is go back to the hospital or go to hospital.
Yes, because it could be that the medication they gave may not have been, let me say, 100% efficacious.
Right.
So, or the child may have now developed a complication or got a new infection. So, if the child was treated and is now still symptomatic, it's good to always go and check and see whether everything is still okay. Or is something entirely different.
Great. Okay. Right. Great stuff. Okay. Did you exhaust your points or you had something?
Yes, I did.
Okay. Right. Now, there's something, folks, and I'm going to ask Abeku to activate the phone lines. We have done that already, haven't we? Yeah. 030-221-6541. Those are the healthy buttons to push to get in on Ultimate Health on Joy 99.7 FM. With me, Nortey by nature. I've got my specialist online, Dr. Pascal Kangbiri. He's a senior resident at the Department of Medicine and Therapeutics in the Kolebu Teaching Hospital. Dr. Emmanuel Asante is specialist family physician practicing at the Medina Polyclinic. If you have any questions, concerns, share them with us. I'm going to read out a couple more of your messages and then activate the phone lines or go to the phone lines again. And for my resource persons, whilst I do that, chew on this. I mean, you rattle and you spew, quite comfortably say COPD, right? But chronic obstructive pulmonary disorders. We see in there emphysema, bronchitis. Can we talk a bit about that and when is it progressing to some of these more frightening ones or more enduring ones like the pneumonias and so on and so forth, right? Let me read a couple of these messages. Good afternoon, Norte and team. Some basic school children are in the dust training daily towards the upcoming inter-schools competition. What should they do under such conditions? Komla from East Legon tells us some kids are training some form of athletics and competition coming up. Hi, Norte. Please, I experienced sore throat with fever and headache last week. Have my sympathy. I've been battling for 2 weeks. I've had some relief now. I went to the hospital, but the test showed no infection. So I was given painkillers and lozenges. It didn't go away. So I went again and opted for anti-malarial drugs. I am now feeling better. Please, what's the reason? Because the test showed negative for malaria as well. My doctors, please note this down so we do the due diligence when we're responding. There's another one said, good afternoon, Norte. Glad to hear you are talking more on the late weather conditions. Since the kids reopened school, I give them fruits, especially oranges, every morning and evening after food. I must say they went to school with some coughs and colds, but my husband and I decided to continue with the citric fruits. And as I speak, they both look good without any medicine. And I guess you will encourage us to keep it up. Is that so? Yes, I encourage you. Z or is it Zeta? Z from Aquiteman. Of course, we all use the mask too when we step out. So they are complying with mask usage. They are using or taking more fruits. And she says she's seen a significant improvement in the kids since they started school. They did ask about eyes. We talked about eyes, itchy eyes, and some of the other conditions, conjunctivitis and other things. Do come up. My guest will talk about that. Indeed, there's a lot also on skin reactions during this period. All right. So we'll see if we can cram that in the 14 minutes or so we have left. Okay, let me go back quickly to my guests and also remind you the phone line is active 0302-216-541. We try to do all the multimedia. Yes, I see Dr. Pascal Cambere on my screen first. So, yeah, some of these questions, any responses for some of them?
Okay, yes. As for the training in the dust, it wouldn't be advisable. Some, like we said, the dust can trigger certain conditions like asthma. So if the person is not aware or has it, it can make their symptoms worse.
Okay.
So I would say put off the training or minimize the training as much as possible, or
So
find a less dusty
schools and institutions, maybe even indeed workplaces, should be responding to these directives and advisories, not just us as individuals. We should see the workplace, the schools also showing, should I say, a response to the conditions and the advice given.
I totally agree. The health of your pupils or workers are important. You need them to be able to attend the school safely. So you also have to be sure you safeguard their health by also following the necessary directives that will help prevent certain respiratory conditioning or worsening of certain conditions.
Okay.
So I think it also play a role in trying to limit that kind of activities.
Okay.
In terms of the gentleman who went to the hospital with sore throat fever, and then there was nothing that was
no infection detected. Yeah.
No infection.
No malaria either.
No malaria. It's a common day thing. Some people will feel that I have malaria. For them, their symptoms is headache. Some of them had bad dreams. They go and take an anti-malaria. It works.
All right.
Sometimes this can be what we call placebo effect, because your mind is telling you it's malaria. So whatever you take to treat malaria, your mind says you're better, therefore you feel better.
Okay.
That may be the case. But again, no test is 100%. And sometimes when you present early, the test may not be able to pick up the infection or the problem because it's still in the infancy, it's still in the early stages.
Right.
So that may, in his circumstances, may have been what happened.
Okay. Right. I'm trying to remember. Did they ask about eyes?
Yes.
Okay.
So,
yeah, Dr. Santi.
All right. So with the eyes, as we said, the thing is this: as the Earth revolves around the sun, right? I mean, people on Earth experiences changes in our climate conditions, right? And for us in Africa, it's about rainy season and dry season, and it comes with a lot of wind and dust. So you realize that dust is all over. You wash your car, within a twinkle of an eye, it's all dusty.
Right.
Right. So this dust at times come in contact with the eye.
Right.
Okay. So as he said, you tend to have degenerative conditions of the eyes, the cornea, and the conjunctiva. Right. So conditions like cataracts can develop. Peduncular and pterygium, which are conditions of the eye, can also develop. Right. Corneal degeneration, and
Doc, slow down, or don't lose us.
yes.
When we say, for example, conditions of the eye, just let's break it down. So, is it that the eye will become red, inflamed? Yes. What are we talking about here?
There will be some inflammation, right? Which would be characterized by, irritation and burning sensation of the eye.
Okay.
Right. You can be tearing, and discharging a lot of fluid from your lacrimal ducts and all that, and you'll be scratching. And as you scratch, you also be unconsciously be introducing infection into the eye and all that. So it is important that people know this about dry Harmattan season like this, and that it does not just come just as dry. It carries a lot of dust, and it can come in contact with your eye.
Okay.
And again, the question about malaria, as my brother rightly said, okay, you see, there are other indicators that we look out for, okay, depending on the developmental stage or the cycle of the malaria parasite. Okay?
Right.
So sometimes even the Plasmodium, the common one to us, you may not pick it up with a microscopy. Okay, it may be so. It can be some other types of parasite which is causing that, and probably we may not pick it up, quite as early as we want it to be.
Okay.
So you may not see anything. So it is not far fetched for a physician or a prescriber to tell you that go and come. There is a reason for that.
Okay.
And we shouldn't forget that we are living in an endemic region of malaria.
Right.
All right. And there are full blood count findings which can also point to us that the person is having malaria. So it is not far-fetched. There's a reason for that. And then once we have the high index of suspicion and our clinical acumen is on point, I mean, we can still give anti-malaria and you'll be good to go.
Drill down and get it sorted. All right, this inflammation and infection of the eye, conjunctivitis that we hear about, again, I'm checking to see. You would advise that you proceed to hospital and get it checked out. Many people, again, typically would buy some over-the-counter ointment, drops, and so on and so forth. Does this kind of presentation need also to go to the doctor or the hospital for evaluation and investigation before you say, well, I have this eye drops, or indeed from last year I have some eye drops left over, right? Typical patterns of behavior. What should we do? Yeah, what should we do with that? I mean, my mom has ointments, okay, the same kind of symptoms, therefore probably the same infection and so on and so forth. Just expand a bit on that for us, the eye conditions.
Yes. So, I mean, basically, okay, we have what we call first age, approach in management to some of the eye conditions that people tend to experience. Maybe something falls on your eye, we say we can, wash your eye with running water and all that, okay? You can irrigate your eye and all that, some things that can be done at home. Some over-the-counter medications like painkiller eye drops, and we have what we call artificial tears. Right? Yes, some areas it suits the eye and then, brings a little bit of relief.
Okay.
You see, so once you achieve that, then you proceed to the hospital, because it could be something worse than that. A foreign object or material may be on your eye, which has to be taken out. So it is important that, when probably you administer the first aid, artificial eye drops or painkiller eye drops, which a lot of the time people sell over the counter, you quickly proceed to the hospital. So, like I said, some of these conditions, irritating conditions of the eye, which comes with dust in the Harmattan season, can cause a lot of degenerating conditions of the eye. Right. So you don't want to remain at home when you experience that.
Right.
And then quick one, Nortey, the skin issues. You see, the dry season carries dust. And the dust sometimes mops out or takes out moisture from the skin. And that moisture that it takes out from the skin is what results in a lot of the scaling and the scarring and the cracking of the skin. So we advise that, the lips, and all that. We advise that we use a lot of our very well-known shea butter and those moisturizing creams to keep our skin moist and
Great stuff. Right, great stuff. 54 minutes past the hour of 2. Dr. Kangbiri, can you quickly, I veered into the COPD, right? Obstructive pulmonary disorders, where breathing is difficult and all that, the emphysemias, the bronchitis, the pneumonias. Are we suggesting to our listeners that whilst we try to prevent in response to the conditions and weather and environmental conditions, we should not perhaps be, unless otherwise advised, be worrying about these other conditions? Many people, will tell you later they said it was pneumonia. I thought it was just my typical normal allergic reaction and so on and so forth. And then how should this inform the response and the lab investigations that need to be done?
Okay, thank you for that. So when we say COPD or chronic obstructive lung diseases, usually it's like a spectrum. It's composed of various conditions, which you rightly said, emphysema and then chronic bronchitis, and asthma also falls into that. And there are various characteristics and various causative etiologies or things that cause them. We won't get too much into that, but they kind of cause, most chronic respiratory tract can come with what we call exacerbation.
Right.
So you have it till the day you die, but then there'll be episodes whereby your symptoms that is related to that disease becomes worse or it becomes very frequent depending on the control.
Right.
And one of the commonest triggers, especially asthma, could be like dust, strong smells, etc. And then infections as well, respiratory tract infections like pneumonia can trigger can trigger acute exacerbation of the asthma or your COPD. So if you come and then you have asthma and say it was pneumonia, it could be that the pneumonia triggered the attack, that's why it came to the hospital. And both of them may have similar symptoms like cough, producing of sputum, so it may be a bit confusing to the individual. So we have to do lab investigations to kind of streamline what we are doing and what treatment you are doing, whether there's a post-chest infection, which will give antibiotics, appropriate antibiotics, and then treat your asthma with your inhalers and those things. And then see you in a short time to make sure you are responding well to treatment.
Right. Okay. Great stuff. You just made my day by saying antibiotics, appropriate antibiotics, because they are not supposed to be over-the-counter medications, but you can get whether it is zithromycin, amoxicillin, cipro, doxy. The people rattle these things more than the prescribers and the chemists or the pharmacists. So the abuse and the incomplete treatment or compliance with some of these things. Can we talk about that alongside the likelihood that under these conditions, these things are going to be further abused? In our discussion so far, we're almost done for today. We haven't brought in antibiotics and we haven't brought in the distinction between what is viral and what is bacterial. But people go in there and it's smash and grab. They go grab these things and they are in the business of self-medication. I'll take comments from both of you on this. Yeah. So Pascal first.
All right. Okay. I totally agree. Antibiotic stewardship is some of the things we look out for because we're seeing more and more of the common bacteria becoming resistant to the everyday antibiotics. So it makes it very hard to treat certain common infections. As you rightly said, most of the medications are not tightly regulated, so people can just abuse them. Some will just call their doctor and then they'll send them a WhatsApp prescription without really examining to see whether they need the antibiotics.
Okay.
We all guilty of that.
Mm-hmm.
But in the interim, we also have to do our best to make sure our antibiotics are safe and protected. So you should use it when it's needed.
Right.
Viral infections usually will not respond to antibiotics, but most viruses, they'll run a course and self-abort, or they'll run a short course, and then your symptoms or condition will resolve because your body deals with it.
Okay.
But you take an antibiotic for a viral infection, and then the viral infection will clear on its own, and you think it's antibiotic, it was a bacterial infection when it wasn't.
Okay.
So there's what we also have to do in educating the public in terms of that. And because people are advised to stay indoors, some of them may stock up with antibiotics just to feel better. Some people take antibiotics when they have a headache.
Right.
Okay, because that's what makes them feel better. You know, so there's a lot of education that need to go out in terms of antibiotics and safeguarding. And our pharmacists as well, we also implore them to also, when they see the patient and they feel like they may not warrant an antibiotics, they should also advise them and let them also go and seek the necessary help, or be more emphatic on getting a prescription, a physical prescription, and not just from the phone. Right. So that they can verify the person who was indeed given an antibiotic.
Okay. So in certain situations, we will want to properly verify and see the patient.
Yes.
Of course. Yes. E-medicine, e-pharmacy and all that is all good. But what my docs are saying here is that, hey, look, sometimes you need to be seen, you need to be examined, you need to present samples for examination and so on and so forth. So it's not right? Dr. Asante, you were coming in quickly.
Yeah, so in as much as telemedicine and teleconsultation is important, especially in the practice of family medicine, you see, it never takes the place of physically being present and being attended to.
Right.
By a qualified, well-trained physician. You see, so the bottom line of what my colleague was saying is just to prevent antimicrobial resistance to antibiotics. All right, most of the people know the doctors, and they know the prescription we normally give out to them. So they tend to go out there and then abuse some of these things. And I don't think it's right, because the more it continues, the more the germs develop. How do you call it? Resistance, and the medications really don't help us. We know it. So it is important that we take precautionary measures along these lines.
All right.
And again, Nortey, before I end, you see, Harmattan also has its own positive effects that we need to.
I hear it has an impact reducing the vectors of malaria and so on and so forth.
Exactly. Mosquito levels are reduced. Atmosphere can be most pleasant, because then the dry season dims the sunlight. So somehow we're able to experience, a well, conducive atmosphere to do other things, right? You sweat less, right, as compared to a situation where the humidity is very high and all that. Right? You have better preservation of your food, and your laundry dries quicker. All right, somehow. Okay, so it is important that we also realize the importance and how it helps us. Okay, all right. For the expats and the foreigners, they may have a hard time experience with the dry season, but with most of our folks, right, who are used to it, they know how to go about it. But then, of course, with the impact of climate change and global warming, we still need to educate people to let them know that the conditions and the negative side effects we just touched on can be worse.
Right.
And it's important that we are abreast with that.
Okay.
And one last thing.
Yeah.
One last thing. People with sickle cell diseases.
Yeah.
Sickle cell disease should also stand, the risk of getting into crisis, because then, the condition reduces visibility, especially, in the day. So drivers are advised to be careful and slow down when they are driving. Okay, and it reduces oxygen saturation in the atmosphere.
Right.
So you realize that people with this condition who already have issues with their hemoglobin and oxygen saturation and all that,
right,
tends not to have sufficient oxygen in their hemoglobin or in their red blood cells to distribute blood and oxygen to the other parts of it. So they tend to have a lot of crises where they have bone pain and they are not able. So they are advised to be taking their medication, their painkillers. They should be regular and frequent in the hospital visit. They should take in a lot of water because they also dehydrate. Right. When that happens.
Spot on. Coupled with dehydration as well for sickle cell, right? They need to be well hydrated as well.
Yes.
Yep. Great stuff. Yes. We've run out of time. I had wanted to challenge my doctors with a typical and common fear we all have when all these kinds of signs and symptoms and complications come up, which is that when we go to the hospitals, and everybody's coughing, and there doesn't seem to be proper infection control even at our health facilities. You see OPDs that are congested, and the same things you are told to avoid, you go and meet them at the facility. So I was going to toss that across. My producer is showing me the VAR that we're out of time, but we can always schedule next week to come back and look at the specific presentations in a bit more detail, right?
Yes.
If I can get the two of you, whether in studio or online. But it's been awesome. We've learned to understand some of these presentations and take the advisory seriously as individuals, groups, employers, heads of institutions. The schools should also, and some of them have given out precautions and measures as well. Dr. Emmanuel Asante, I'm most grateful. And it's been lovely meeting and sharing with you. And Dr. Pascal Kangbiri as well. Most grateful. Lovely interacting with you. And both of you have enriched our programming today. I was looking to see if either of you were Kolebu trained. Sadly, none of you were from my hood. But now that extends our resource base for ultimate health. Many thanks. Let me see if I have any. Abeku, do I have any WhatsApp to read? Nope. Okay. So listeners, we'll probably wrap it up maybe with a more extensive drill down next week on the presentations. Many thanks for listening to this yet another educative, easy to digest package of Ultimate Health, your ultimate guide to healthy living. With me, Nortey by Nature, produced by Abeku Sankofi. Stick and stay. Don't go away.